Hey there, I'm Tracy Matthews. I'm the Chief Visionary Officer of Flourish and Thrive Academy, the host of the Thrive by Design podcast, and the author of the Desired Brand Effect book. I help jewelry brands scale to multiple six figures and beyond by getting their heads and their businesses in the right space for growth and scale. So, mental health, obviously, it is a sensitive topic. So before we dive into this interview with Jennifer Tippett, I want to say, make sure that if you're drawn to or interested in anything that we share in this episode, please consult your doctor and also do your research. That's really, really important because there is never a one-size-fits-all strategy for overcoming trauma and all of these other healing modalities. This is just an interesting conversation. I'm going to put my glasses on for this introduction because I'm going to have to read some of it. Jennifer Tippett is a badass. She's a friend of mine. She is also the professor at the University of Denver and the director of Substance Abuse Disorder Specialty Unit in their doctoral program. She specializes in trauma and addiction and the use of psychedelic medicine in therapeutic settings to help heal trauma. She specifically focuses on severe and persistent mental illness, schizophrenia, long-term depression, and bipolar disorder. She's also worked in community mental health and in the prison system. And in her private practice, she works with this population in therapy and also coaches people before and after the use of psychedelics. So let's dive in to today's episode with Jennifer Tippett. All right, today I am here with my friend, Jennifer Tippett. Jen, thank you so much for being here today.
Thanks for having me.
Jen is an expert in psychedelics and trauma. And today we're going to be talking about how to handle mental disorders, depression, and other trauma that might affect your creativity and how to kind of overcome it with alternative methods, maybe we shall say, and just a different way about thinking about it. So Jen, thank you so much for being here.
Yeah, I'm excited.
It's awesome to have you here. So I met Jen actually through, I guess the best way to put it is like what we call the journey space or trauma healing space, or you go and you kind of work on yourself. And from the moment I met Jen, I thought she was an amazing person in general, but also just she has an awesome talent for integration and helping people kind of integrate the parts of themselves that they might want to dismiss. Jen and I are also in a business group, so we've got to hang out a lot, and I'm just really excited to chat a little bit more about you and your journey. So thanks for being here, and let's start with that. Like, tell us a little bit about your journey and what you do.
Yeah, so I'm a licensed clinical psychologist. I'm a professor, I teach. My areas of expertise are sort of varied. I was a forensic psychologist in kind of my early professional life, but I'm also the director of the Substance Use Disorder Specialty at the University of Denver. So I train doctoral students. I always say I teach baby psychologists. I put it. They're gonna be psychologists. They're learning to be. And then, also I have a private practice. I do a lot of integration work, folks who have a psychedelic experience or want to do some set and setting and some integration. And a lot of what I talk about, both in practice and teaching and my job and everywhere, is trauma and the ways that manifests for people. So it's a little bit about what I do. I do a lot of couples work. I do a little of this, little of that.
A lot of things. Well, okay, so trauma really has a range. I guess it's so weird to say because like we've all had trauma in our lives, but like the interpretation of trauma can go anything from like, being told something by your parents and like having a belief system all the way through to like being abused or abandoned and whatever. So what is your definition of trauma and how do you kind of help people, or not help people with that, but how do you define it?
Yeah, that's such a great point. And something that we as a field really missed for a long time, I think. Our early kind of definition of PTSD or trauma was very much like event-based, like something bad had to happen to you. And then these 4 things were the result. Otherwise, you didn't have PTSD. And we've kind of expanded that a little bit to include things like emotional dysregulation or avoidance, dissociation, stuff like that. But I still mostly have people come in and say, well, I don't have any trauma. Nothing bad has ever happened to me. And then we start talking about their childhood. And it's like, oh yeah, well, my dad called me names all the time, but like, it wasn't trauma though. Like, that's not really abuse. And it's like, well, to a tiny human, that's pretty hard to integrate, right? And there's no one to turn to, there's no one to support you. So this like, sometimes low level, what I call like ambient trauma. So maybe one of your parents was an alcoholic and was really not emotionally available. And you then had to pick up the slack and be the adult when you were supposed to be a child. That's really hard on a developing human. And so that could be trauma. So I don't have a definition of trauma. I think it's more about functioning and how you started to learn to function in the world. And certainly there are events, right? A sexual assault, a car accident, things like that, that we know like that was traumatic. But there's also these ways in which we are in the world or other people are to us in the world that impacts our neurobiology and our nervous system in ways that it wouldn't have, otherwise developed. And that gets to be just as relevant.
It's interesting. Yeah, because like I'm working on my trauma for so long, but nothing ever really bad happened to me. It's just about how I'm showing up in the world and how my childhood affected me as an adult. And it's been an interesting process. And this work is so powerful when you let it. And I think that it's what you're doing is so amazing. So I wanted to kind of ask a follow-up question on this. Like, how do you know if you have PTSD or if you're experiencing trauma? And like, does everyone have it or some sort of it or no?
Yeah, I mean, PTSD is just a thing we made up, right? Post-traumatic stress disorder is just a thing the field of psychology was like, well, here's this cluster of symptoms, we're going to call it something. And the more we learn about trauma, it's sort of expanded to include a few more symptoms. Maybe that's PTSD. There's a lot of argument within the psychological community that doesn't actually do a great job of encompassing trauma. So as people say, well, I don't have PTSD, that might be true. You might not meet like the DSM criteria for trauma or for PTSD, sorry, but that doesn't mean trauma. So often, what I find is it's more about functioning and how you are in the world. I talk a lot about nervous system regulation. Trauma really destabilizes a person. I keep wanting to say an organism because that's how I teach. We are organisms. But trauma really destabilizes a person's ability to regulate correctly and to interact with the world around them, including other humans, in a way that is functional and helpful. So often people will find themselves kind of stuck in these patterns that are left over from childhood and what we might call trauma informed. So trauma responses.
How does this affect creativity and mental health? Like, how does it manifest in the real world? Because I'm curious, like, what are some of the manifestations of trauma on mental health?
Well, interestingly, I mean, trauma impacts all sorts of ranges of mental health, from like managing your own emotions, self-soothing, avoidance. But, even with creativity, one of the things that we know that trauma often shuts down is creativity. So it can really blunt one's ability to be creative, to experience joy, to have play. Like those things kind of fall into a bucket for me. So folks who have trauma can sometimes be very rigid, very prescriptive, like things are not safe unless you do them a certain way. And that really impedes your ability to be creative, for sure.
Yeah, all that structure, which is good. Maybe that's why my desk is so messy.
It's good. The next time someone says anything, just say,
it's my creativity, all the bills everywhere.
Yes. Absolutely.
I'm just kidding. Okay, cool. So there have been so many studies about psychedelics and healing trauma. And years and years and years ago, before I was with Jason, I dated a former Navy SEAL, and he would go like off the grid for days, sometimes months. And I'd be like, what the heck happened? We were just having a great time. And like, I thought things were moving along, and now he disappeared. And he came to me one day and tried to explain what was going on with him. And it's like, sometimes for people who have severe trauma or PTSD, it can be overwhelming. So I'd love to hear kind of your experience with that and how psychedelics, like all the research on psychedelics and what that really means and how it's helping people who have severe, everything from severe PTSD to more mild trauma, like what the average person might have.
Yeah. Yeah. A lot of those early studies that you're referring to are looking at MDMA, which some people think is ecstasy. There's MDMA in ecstasy. It's not the same thing as ecstasy.
Yeah.
There's a whole lot of other things in ecstasy, and that's another podcast. So those really early studies were looking at MDMA and trauma, especially in the veteran population, primarily done by MAPS, which is a large nonprofit organization. And they really pioneered these clinical trials to start to look at what happens for folks when you do trauma treatment concurrent with a psychedelic like MDMA. And your point is a really good one for people who have experienced like war, a sexual assault or continued sexual assault. There is this large manifestation, these big clusters of symptoms. Like my guess is your Navy SEAL sometimes just couldn't deal and really could be around people or whatever. It can really manifest in ways that are like, I got to be alone by myself in my room. I can't handle the outside world. And what they found is that with MDMA, when it was paired, folks started to show not just symptom reduction, which is what we usually see with like SSRIs or antidepressants, but symptom remittance. It's gone.
Oh.
And so in psychology, we never say anything is cured because it's a human and we're very complex organisms. But there seems to be a real change in the way that the person functions after exposure to psychedelics. And we're starting to see that replicated, not just through the MAPS studies, which are now in phase 3, but also some psilocybin studies are also very promising to look at. So the research really does suggest that this is not just a dampening down of feeling or emotion, but more a grappling and a reprocessing of the thing that happened for folks.
Wow. And it's allowing people, I feel like, to have more functioning lives in a lot of ways.
Yes.
Yeah.
Even if you have like that ambient trauma, you can still be very avoidant, which makes it hard to deal with people or life. You know, like it doesn't have to be you're in the corner shaking all the time. Although certainly if you are, that makes it really hard to hold down a job. So trauma just impacts every realm that you can think of for people.
Yeah. And I don't want to get too dark here, but I had a friend from high school who happens to be like one of my best friend's cousins who committed suicide. He was a Army veteran and he just had lost his purpose. And I feel like when this stuff is not dealt with, you can fall into such great depression that it's important to figure out some sort of way. And I really love how psychedelics can help people literally transform their lives and become different people and pull themselves out of that depression, out of those like mental slumps that like cause them to do something terrible like that.
Yeah, yeah, absolutely. And even like ketamine is great for suicidal depression. That's really showing promise for depression and anxiety. So it's been a great discovery. I use that word lightly because indigenous cultures have known this for a long time, but in our Western world to say like, oh, these things have a purpose. It's been great for the mental health field.
So tell us about how you would use psychedelics in a clinical setting, like when you're working with patients, like how does it work?
Yeah, so it's illegal to give or be around, provide any substance or be there for somebody when they're on substance outside of a research setting. The way that my practice typically works is someone will, call and say, I want to do a psychedelic, and we'll do a set and setting meeting. So that's really just talking about intention setting and like, where are you going to do this? What are your expectations? That sort of thing. And then the person goes and does whatever it is that they're going to do.
Yeah.
And then, we do some integration sessions afterwards and talk about the experience. And it really is kind of about what happened in the experience. How does that then translate to your life in a way that's meaningful and can change the way that you function in the world? As big or as small, it doesn't matter, but whatever was profound for them. So that's kind of the work that I do.
I love that. And so like really reprogramming the neural pathways in your brain to operate differently. So that's why if you meditate for like a month and then you stop, like the benefits of meditation like subside. You need to continue meditating in order to get the benefits. And like, it's so being consistent is really the key to this.
Yeah.
So I'd love to talk a little bit more about like traditional pharmaceuticals that are used for mental health and depression versus psychedelics, and like how, like the difference between the two, and like where is the, I'm going to say the industry going, or where is the science going with this?
Yeah, well, that's going to be quite a showdown.
I know, right?
Probably imagine. The pharmaceutical industry has got a good thing going. So, traditionally we recommend, or psychiatrists or primary care docs or whoever prescribes what are called SSRIs or antidepressants is shorthand. And, they work for kind of about half the population. So if you look at studies, they range from like 38% to like 56% of folks actually find relief when they're taking an antidepressant. And if you go to your doctor and you say, hey, this didn't work, Prozac isn't doing it for me, what they'll do is take you off that and put you on a different one. And if that doesn't work, they'll take you off that and put you on a different one.
Yeah.
And if that doesn't work, they'll pair it with an atypical antipsychotic to see if that helps. And if that doesn't work, maybe they'll try a mood stabilizer. And it all stems from this theory that depression and anxiety were caused by a lack of serotonin in the brain. And we now know that that's not exactly correct. There probably is an imbalance of serotonin. Most of your serotonin receptors, by the way, are in your gut. They're not even in your brain. And there's this whole host of other things that are involved. And so this idea that you can take a pill and it's going to regulate the neurochemicals in your brain and you're going to feel fine, it works for some folks, and I don't knock it for those that it works for. If you can take Lexapro and feel great, do that. That's a great idea. If you are finding that you are trying these things and nothing is working, or it's not working well, or you're feeling numb, you're feeling shut down, then maybe it's time to look at something else. And so I think the hope, at least in the psychedelic field, is that psychedelics will provide an alternative for folks who are not finding relief in other ways.
Okay. Yeah. That's interesting. You brought up like something from the past. And my ex-husband was like really struggling with depression, kind of like at the end of our marriage, and still deals with it. I really think that it's more bipolar disorder, but it was hard because like, I didn't know what to expect. And then he went on antidepressants or SSRIs, and then he would be jumping around. And then he had this other bout, and I don't want to say too much, where he almost like tried to kill himself. And it was, it's a lot, it's a lot to deal with as someone in a relationship with someone like that, or even like not even in the relationship, but still caring about them to watch happen. And so it's so exciting to me that there's these other types of therapies that could potentially help in different ways. Now, I know a lot of times with mental illness, like one of the, I don't know if this is a side effect, I'm probably saying this wrong, is like drug addiction or alcoholism and some of these other things. Do you want to talk a little bit about that and how this helps people maybe heal their addictions, or how does maybe a better question is, how do psychedelics kind of play in the role of like overcoming addiction?
Yeah, we don't quite know yet. There's some really promising studies looking at specifically alcohol use disorder and nicotine use disorder. Psilocybin. There's a long-standing history of ibogaine helping folks get off of opioids. That's one that doesn't get talked at or looked at as much in our country, but there are out-of-country clinics. So I think the hope really is that this can offer some help for those folks. Certainly, it's not uncommon to find a substance use disorder hand in hand with a mental illness like depression, like bipolar, like trauma, tons and tons all the time. And it's really, people are just trying to figure out ways to regulate their internal state, right? We just want to feel better. And if you find something that makes you feel better, you kind of keep doing it, especially if you get a wash of dopamine in your brain and your brain's like, oh, this is good. Let's keep doing that, right? And then you've got an addiction down the road. So they definitely interact. And the hope is that through substances, you can help people get off the substances. I always tell my students, there's no such thing as a bad substance. We did this weird thing in the 70s with Nixon, where it was like, there's good drugs and bad drugs. It's not true. It's all just substances. It depends on how you use them, why you're using them, how it's, interacting together. And so finding the ways in which we can help people regulate themselves more consistently and internally without reaching for something external like heroin is a great idea.
Yeah, right. I'm not sure about that, but
seems like a yes.
oh my God, that's hilarious. Yeah, I mean, it just goes back to like a glass of wine with dinner, nothing wrong with that. Whole bottle of wine or two, probably not good for one person to drink, right?
Yeah. And definitely not every day, right? That's going to really impact your sleep, your function.
I know, exactly. So what are some words of advice that you have for people who are struggling with mental disorders, or they feel like their state of mind or whatever is affecting their creativity? What are some actionable things that they can do to kind of, I don't know, snap themselves out of it, or to just move towards a more healthier life and style?
That's a good question. And of course, I'm biased towards therapy. If you can find a good therapist, I think that's always a great idea. Things like meditation, which we mentioned, is really nice. Movement, so yoga or any sort of movement can be really useful for kind of lifting the mood. Watching diet, we actually know that diet is super connected to mood and mood regulation, which we used to kind of poo-poo a bit. So all of these things, it's like a general wellness piece can really impact your mood. And the artists that I know can sometimes struggle with this, right? Like you're up eating all night, or you're painting and you're inspired, you're going to do it. So you don't sleep, you don't eat, you don't get outside. That can really impact your mood. So having an idea of your general wellness and sticking to a schedule and making sure those things are regulated can really help.
Okay, awesome. Awesome. Is there anything else or any other words of advice that you'd like to share with the audience today?
I think, overall, just being mindful of what you need, right? And giving yourself that, whether it's therapy, whether it's medication, whether it's trying a psychedelic experience, which legally I can't tell you to do or not do. Whatever calls to you, there is innate wisdom in each of us that knows what we need. And if you can tap into that, it's not a bad place to start.
Exactly. And there's always places you can go outside of the country where it's legal to have those experiences if you want to. Anyway, Jen, thank you so much for being here today. Where can people find you?
I have a website. It's drjennifertippett.com. That's the easiest place.
Thank you so much for being here today. That was awesome.
Yeah, thanks for having me.
Thank you so much for tuning into this episode. And of course, if you're experiencing any mental health issues or your traumatic experiences that have gone unresolved, I highly encourage you to enlist the help of mental health experts. In the show notes and caption below, we are going to have some resources for you that you can lean into and some hotlines you can call. Thanks so much for listening today. This is Tracy Matthews signing off.